Question 1. The audit findings indicate that a certified trauma and resilience practitioner, CTRP, received a disclosure from a client regarding past traumatic experiences that, while not immediately indicative of current danger, suggest a pattern of behavior that could potentially lead to harm to others in the future. The CTRP is unsure whether this disclosure necessitates reporting to external authorities or if it falls strictly within the bounds of client confidentiality. Which of the following represents the most appropriate professional response in this situation? Option A. Disclose the information to a trusted colleague for their opinion, without formally documenting the consultation or seeking expert guidance, to gain a quick perspective on the situation. Option B. Immediately consult with a supervisor or legal counsel to review the specific disclosure, assess potential risks, and determine the CTRP reporting obligations under the relevant regulatory framework and ethical guidelines before taking any action. Option C. Maintain strict confidentiality and take no further action, as the disclosure does not present an immediate threat to the client or others, and any breach of confidentiality could damage the therapeutic relationship. Option D. Inform the client that the disclosure is concerning and that the CTRP is obligated to report it to the authorities, regardless of the potential for future harm, to err on the side of caution. The correct answer is B. Immediately consult with a supervisor or legal counsel to review the specific disclosure, assess potential risks, and determine the CTRP reporting obligations under the relevant regulatory framework and ethical guidelines before taking any action. Explanation. This scenario presents a professional challenge because it requires balancing the ethical and legal obligations of confidentiality with the potential need to disclose information to ensure client safety or fulfill reporting requirements. The Certified Trauma and Resilience Practitioner, CTRP, must navigate complex situations where a client's disclosure of past trauma may intersect with current risks or legal mandates. Careful judgment is required to determine the appropriate course of action, ensuring that client trust is maintained while adhering to professional standards and legal frameworks. The correct approach represents best professional practice because it prioritizes a client-centered, ethical, and legally compliant response. This involves a thorough assessment of the disclosure's implications, a clear understanding of the CTRP duty to warn or report, if applicable, and open communication with the client about any necessary disclosures. This approach upholds the principles of beneficence, non-maleficence, autonomy, and justice, while strictly adhering to the specific regulatory framework governing CTRP, which emphasizes informed consent and the protection of client information unless legally mandated otherwise. Each incorrect approach represents specific regulatory or ethical failures. One incorrect approach might involve immediate, unqualified disclosure of client information without assessing the necessity or legal basis for doing so. This violates the fundamental principle of confidentiality, potentially causing harm to the client and breaching professional trust. Another incorrect approach could be to withhold information that legally or ethically must be disclosed, such as in cases of imminent danger to self or others, or mandatory reporting of child abuse. This failure to act can have severe consequences for the client and others, and constitutes a breach of professional duty and potentially legal obligations. A third incorrect approach might be to make assumptions about the client's intent or the severity of the situation without engaging in a proper assessment and consultation, leading to inappropriate actions that undermine the therapeutic relationship and professional integrity. Professionals should employ a decision-making framework that begins with a thorough understanding of the client's disclosure and its context. This includes assessing any immediate risks or harm. Next, the professional must consult the relevant regulatory framework and ethical guidelines to determine their specific obligations regarding confidentiality and any exceptions. If disclosure is contemplated, the professional should, whenever possible and safe, discuss this with the client, explaining the reasons and potential consequences. Seeking supervision or consultation with experienced colleagues or legal counsel is crucial when navigating complex ethical dilemmas. The ultimate decision must be justifiable based on the established professional standards and legal requirements, always prioritizing the client's well-being and safety within the bounds of ethical practice. Question 2. Risk assessment procedures indicate a client who has disclosed a history of severe childhood trauma involving neglect and abuse is expressing significant distress and suicidal ideation. The client explicitly states they do not want any information shared with their family who they believe are the source of their current distress and are not supportive. The practitioner is concerned about the immediate safety of the client. What is the most appropriate course of action? Option A. Document the suicidal ideation and the client's refusal to involve their family, and then cease further intervention regarding safety planning until the client explicitly consents to further action, as respecting client autonomy is paramount. Option B. Breach confidentiality and report the client's suicidal ideation to emergency services and relevant authorities without further discussion with the client, prioritizing immediate safety above all else. Option C. Engage in a collaborative discussion with the client to explore their safety concerns, understand their reasons for not wanting to involve their family, and collaboratively develop a safety plan that addresses their immediate distress while respecting their stated boundaries as much as possible, documenting all discussions and decisions. Option D. Immediately contact the client's family to inform them of the client's suicidal ideation and request their assistance in ensuring the client's safety, as family support is often crucial in crisis situations. The correct answer is C. Engage in a collaborative discussion with the client to explore their safety concerns, understand their reasons for not wanting to involve their family, and collaboratively develop a safety plan that addresses their immediate distress while respecting their stated boundaries as much as possible, documenting all discussions and decisions. Explanation. This scenario presents a professional challenge due to the inherent tension between a client's expressed desire for privacy and the practitioner's ethical and potentially legal obligations to ensure safety. The client's history of trauma may influence their perception of authority and their willingness to disclose information, making a purely directive approach counterproductive. Careful judgment is required to balance the principles of autonomy, beneficence, and non-maleficence within the trauma-informed care framework. The correct approach represents best professional practice because it prioritizes collaboration and client empowerment, core tenets of trauma-informed care. By seeking to understand the client's concerns and exploring their rationale for withholding information, the practitioner upholds the principle of respecting client autonomy. Simultaneously, by gently probing the safety concerns, the practitioner fulfills their duty of care to assess and mitigate potential risks, aligning with the principle of beneficence. This approach builds trust and strengthens the therapeutic alliance, which is crucial for effective trauma work. An incorrect approach that focuses solely on immediate risk without exploring the client's perspective fails to acknowledge the impact of trauma on trust and disclosure. This can re-traumatize the client by invalidating their feelings and experiences, violating the principle of do no harm. Another incorrect approach that immediately breaches confidentiality without a clear, imminent, and severe risk assessment, and without attempting to gain the client's consent or understanding, would violate professional ethical codes and potentially legal statutes regarding privacy and confidentiality. This demonstrates a lack of understanding of the nuanced application of safety protocols within a trauma-informed context. Professionals should employ a decision-making framework that begins with active listening and empathy to understand the client's perspective. This should be followed by a collaborative assessment of risks and benefits, clearly explaining the rationale behind any necessary interventions or disclosures. The practitioner must continuously evaluate the client's capacity and willingness to engage in safety planning, adapting their approach as needed, while remaining grounded in ethical principles and relevant regulations. Question 3. Strategic planning requires a certified trauma and resilience practitioner, CTRP, to consider how to best support a client presenting with significant distress, whose history includes multiple adverse childhood experiences ACE. Which of the following approaches best reflects a best practice evaluation of the role of ACEs in developing a comprehensive resilience building plan? Option A. Conduct a thorough assessment of the client's specific ACEs and their current impact, build rapport, and collaboratively develop a personalized resilience building plan that addresses identified needs and strengths. Option B. Present the client with a pre-designed resilience program that has proven effective for other individuals with a history of trauma and guide them through its modules. Option C. Immediately implement a standardized stress reduction protocol, as ACEs are known to increase stress vulnerability, and address specific ACEs only if the client brings them up directly. Option D. Focus on managing the client's immediate symptoms of distress, assuming that addressing the underlying ACEs will naturally follow once the acute phase has passed. Correct answer is A. Conduct a thorough assessment of the client's specific ACEs and their current impact. Build rapport and collaboratively develop a personalized resilience building plan that addresses identified needs and strengths. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a certified trauma and resilience practitioner, CTRP, to balance the immediate need for intervention with the long-term implications of a client's adverse childhood experiences, ACE. The practitioner must navigate the ethical imperative to provide support while adhering to professional standards that emphasize a trauma-informed, client-centered approach. The complexity arises from the potential for re-traumatization if interventions are not carefully considered in light of the client's history. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment of the client's ACEs and their current impact. This aligns with the CTRP ethical guidelines, which mandate a thorough understanding of a client's history to inform effective and safe interventions. By focusing on building rapport and collaboratively developing a resilience building plan, the practitioner respects the client's autonomy and agency, a cornerstone of trauma-informed care. This approach minimizes the risk of re-traumatization and maximizes the potential for positive outcomes by tailoring support to the client's unique needs and strengths. Incorrect approaches analysis. One incorrect approach fails to adequately assess the depth and breadth of the client's ACEs, instead opting for a generalized intervention. This violates the principle of individualized care and risks applying interventions that are not appropriate or may even be harmful, potentially leading to re-traumatization. Ethically, this demonstrates a lack of due diligence in understanding the client's presenting issues. Another incorrect approach focuses solely on immediate symptom management without exploring the underlying ACEs. While symptom relief is important, neglecting the root causes stemming from ACEs can lead to superficial progress and a failure to build lasting resilience. This approach can be seen as a failure to provide comprehensive care and may not fully address the client's long-term well-being, potentially contravening the spirit of promoting resilience. Third incorrect approach involves imposing a predetermined intervention strategy without sufficient client input or consideration of their specific ACEs. This disregards the client's autonomy and can create a power imbalance, undermining the therapeutic alliance. Professionally, this is a departure from client-centered practice and can be perceived as a lack of respect for the client's lived experience, potentially leading to disengagement and negative therapeutic outcomes. Professional reasoning. Professionals should employ a decision-making process that begins with a thorough, trauma-informed assessment. This involves actively listening to the client, gathering information about their experiences, including ACEs, and understanding their current coping mechanisms and strengths. The next step is collaborative goal setting, where the practitioner and client work together to define desired outcomes. Interventions should then be selected and adapted based on this assessment and the collaboratively set goals, always prioritizing safety, client autonomy, and the promotion of resilience. Continuous evaluation of the intervention's effectiveness and the client's well-being is crucial, with adjustments made as needed. Question 4. Stakeholder feedback indicates that while the organization acknowledges the importance of building resilience, the current proposed resilience framework implementation is perceived as overly academic and disconnected from the daily realities of employees. This feedback suggests a potential disconnect between the theoretical underpinnings of resilience and its practical application within the specific organizational culture. As a certified trauma and resilience practitioner, CTRP, how should you proceed to ensure the framework's effective and ethical implementation? Option A. Delegate the adaptation of the framework to a small internal committee, providing them with the theoretical materials and expecting them to present a revised version for review. Option B. Facilitate a series of co-design workshops with diverse stakeholder groups to collaboratively adapt the resilience framework, integrating their lived experiences and contextual realities into actionable strategies, and establish a feedback loop for ongoing refinement. Option C. Focus on delivering a comprehensive theoretical overview of resilience models to all employees, assuming that understanding the concepts will naturally lead to their application in practice. Option D. Proceed with the original framework as designed, emphasizing its evidence-based nature in mandatory training sessions, and address any perceived disconnects through supplementary Q&A periods. The correct answer is B. Facilitate a series of co-design workshops with diverse stakeholder groups to collaboratively adapt the resilience framework, integrating their lived experiences and contextual realities into actionable strategies, and establish a feedback loop for ongoing refinement. Explanation. This scenario presents a common implementation challenge in resilience building programs: the gap between theoretical understanding and practical application, particularly when dealing with diverse stakeholder needs and varying levels of engagement. The professional challenge lies in translating abstract resilience theory into tangible, actionable strategies that resonate with and are adopted by all involved parties, while adhering to the ethical and professional standards expected of a certified trauma and resilience practitioner. CTRP. Careful judgment is required to balance the need for evidence-based practice with the realities of organizational culture, resource constraints, and individual differences. The correct approach represents best professional practice because it prioritizes a collaborative, iterative, and context-specific application of resilience theory. By actively involving stakeholders in the adaptation and implementation of resilience frameworks, practitioners ensure that the strategies are relevant, culturally sensitive, and sustainable within the specific organizational environment. This aligns with ethical principles of beneficence and non-maleficence, ensuring that interventions are helpful and do not inadvertently cause harm or disengagement. It also upholds professional competence by demonstrating an ability to apply theoretical knowledge flexibly and effectively in real-world settings, as expected by CTRP standards, which emphasize practical application and client-centered care. An incorrect approach that focuses solely on a top-down imposition of a predefined resilience model without stakeholder input fails to acknowledge the unique context and lived experiences of the individuals and the organization. This can lead to resistance, low adoption rates, and a perception that the program is irrelevant or unsupportive, potentially violating the ethical duty to provide effective and appropriate services. Another incorrect approach that emphasizes superficial engagement, such as one-off workshops without follow-up or integration into daily practices, neglects the core principles of resilience theory, which often involve sustained effort and the development of ingrained coping mechanisms. This can be seen as a failure to provide competent and thorough service, potentially misrepresenting the efficacy of the intervention. An approach that prioritizes speed and cost-effectiveness over thoroughness and genuine engagement risks compromising the quality and impact of the resilience-building efforts, potentially leading to a failure to meet the needs of those the program is intended to support, which is an ethical concern. The professional decision-making process for similar situations should involve a thorough needs assessment that includes active listening to stakeholder concerns and perspectives. Practitioners should then critically evaluate various resilience models and frameworks, considering their adaptability to the specific organizational context. The chosen approach should be co-designed with stakeholders, allowing for iterative refinement and feedback throughout the implementation process. Continuous evaluation of the program's effectiveness and its impact on individual and collective resilience should be integrated, with a willingness to adapt strategies based on ongoing data and feedback. This systematic and collaborative approach ensures that interventions are not only theoretically sound, but also practically effective and ethically grounded. Question 5. The efficiency study reveals that early childhood trauma significantly impacts an individual's capacity to form secure attachments, often leading to the development of insecure or disorganized attachment styles. As a certified trauma and resilience practitioner, CTRP, what is the most appropriate approach when working with an adult client who exhibits these attachment patterns and whose history includes significant early relational trauma? Option A. Interpret the client's attachment style as a fixed personality disorder that requires long-term psychodynamic exploration without immediate focus on safety and stabilization. Option B. Directly confront the client's insecure attachment behaviors and challenge their perceived inability to form healthy relationships, aiming for rapid behavioral change. Option C. Focus on building a safe, predictable, and consistent therapeutic relationship, employing interventions that help the client process relational trauma and develop new, secure relational patterns, while respecting their pace and readiness. Option D. Prioritize the immediate processing of all traumatic memories to achieve catharsis, assuming that releasing past experiences will automatically resolve attachment issues. The correct answer is C. Focus on building a safe, predictable, and consistent therapeutic relationship, employing interventions that help the client process relational trauma and develop new, secure relational patterns while respecting their pace and readiness. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a certified trauma and resilience practitioner, CTRP, to navigate the complex interplay between early childhood trauma and its long-term developmental trajectory, specifically concerning attachment styles. The practitioner must apply their understanding of trauma's impact on the developing brain and nervous system to inform their assessment and intervention strategies, while adhering to the ethical and professional standards of the CTRP certification. The challenge lies in accurately identifying the manifestation of trauma-related developmental impacts and selecting an approach that is both evidence-based and developmentally sensitive, avoiding oversimplification or misinterpretation of complex human experiences. Correct approach analysis. The correct approach involves recognizing that early childhood trauma can significantly disrupt the formation of secure attachment, leading to the development of insecure or disorganized attachment styles. This understanding is foundational to the CTRP role in supporting resilience. By focusing on the practitioner's role in facilitating a safe and predictable therapeutic environment, and employing interventions that help the individual process relational trauma and build new, secure relational patterns, the approach aligns with best professional practice. This is justified by the CTRP ethical obligation to provide trauma-informed care that addresses the root causes of distress and promotes healing through relational repair and the development of coping mechanisms. The emphasis on a phased approach, starting with safety and stabilization before moving to processing and integration, is a core principle in trauma treatment, ensuring the client's capacity is not overwhelmed. Incorrect approaches analysis. One incorrect approach would be to solely focus on behavioral symptoms without exploring the underlying relational and developmental impacts of trauma. This fails to acknowledge the profound influence of early experiences on attachment and self-regulation, a core tenet of trauma-informed practice. Ethically, this approach risks providing superficial interventions that do not address the fundamental needs of the individual, potentially leading to re-traumatization or a lack of lasting change. It also neglects the CTRP responsibility to understand the developmental trajectory of trauma's effects. Another incorrect approach would be to pathologize the individual's attachment style as a fixed personality trait, rather than understanding it as a dynamic response to early relational experiences shaped by trauma. This perspective overlooks the plasticity of the brain and the potential for healing and growth through therapeutic intervention. It is ethically problematic as it can lead to stigmatization and a failure to provide appropriate, hope-inspiring support. A third incorrect approach might involve prematurely pushing for the processing of traumatic memories without adequate stabilization and the establishment of a secure therapeutic alliance. This disregards the critical importance of safety and readiness in trauma work, potentially overwhelming the individual's coping resources and leading to dissociation or increased distress. This is a direct violation of ethical guidelines for trauma treatment, which prioritize client safety and well-being. Professional reasoning. Professionals should employ a decision-making framework that begins with a comprehensive assessment of the individual's history, including early relational experiences and any reported or suspected trauma. This assessment should inform an understanding of how trauma may have impacted their developmental trajectory, particularly in relation to attachment. The practitioner should then collaboratively develop a treatment plan that prioritizes safety, stabilization, and the building of a secure therapeutic relationship. Interventions should be phased, moving from establishing safety and coping skills to processing traumatic memories and integrating experiences, always attuned to the client's readiness and capacity. This process is guided by ethical principles of beneficence, non-maleficence, and respect for client autonomy, ensuring that interventions are tailored, effective, and promote long-term resilience. Question 6. Benchmark analysis indicates that a practitioner is working with a client who reports experiencing a single, highly distressing event several months ago, leading to significant anxiety and intrusive memories. The practitioner is considering how to best categorize this experience to inform their intervention strategy. Which of the following approaches best reflects a nuanced understanding of trauma types as per best practices in trauma-informed care? Option A. Identifying the experience as acute trauma, recognizing it as a singular event with a clear onset, and proceeding with interventions tailored to single-incident trauma. Option B. labeling the experience as chronic trauma because the client's distress has persisted for several months, overlooking the singular nature of the reported event. Option C. Classifying the experience solely as complex trauma due to the severity of the client's current distress, without further exploration of the event's duration or relational context. Option D. Assuming the client's distress is a general stress response and not a specific trauma type, thus avoiding a detailed trauma assessment. Correct answer is C. Classifying the experience solely as complex trauma due to the severity of the client's current distress, without further exploration of the event's duration or relational context. Explanation. Scenario analysis. This scenario presents a professional challenge due to the nuanced nature of trauma types and their impact on an individual's presentation and needs. Differentiating between acute, chronic, and complex trauma is crucial for effective assessment and intervention. Misidentification can lead to inappropriate treatment plans, potentially re-traumatizing the client or failing to address the root causes of their distress. The practitioner must exercise careful judgment to accurately categorize the trauma experience based on the client's narrative and observable behaviors, aligning with best practices in trauma-informed care. Correct approach analysis. The correct approach involves a comprehensive assessment that considers the duration, repetition, and relational context of traumatic experiences. This aligns with the core principles of the Certified Trauma and Resilience Practitioner (CTRP) framework, which emphasizes understanding the multifaceted nature of trauma. Specifically, it recognizes that acute trauma is typically a single, overwhelming event, while chronic trauma involves repeated exposure over time. Complex trauma, however, is characterized by prolonged, repeated trauma, often interpersonal in nature, occurring during critical developmental periods, leading to pervasive disruptions in functioning. A best practice approach would involve gathering detailed client history, observing behavioral patterns, and utilizing validated assessment tools to differentiate these types, thereby informing a tailored and effective intervention strategy. This adheres to ethical guidelines that mandate competent practice and client-centered care. Incorrect approaches analysis. One incorrect approach would be to solely focus on the intensity of a single event, labeling all significant distress as acute trauma. This fails to acknowledge the cumulative and pervasive effects of chronic or complex trauma, potentially leading to an underestimation of the client's needs and a superficial treatment plan. This approach violates the ethical principle of competence, as it demonstrates a lack of understanding of different trauma typologies. Another incorrect approach would be to assume that any prolonged period of distress automatically equates to complex trauma, without a thorough exploration of the nature and origin of the traumatic experiences. This can lead to misdiagnosis and the application of interventions that may not be appropriate for chronic trauma, which, while pervasive, may not have the same relational and developmental impact as complex trauma. This also represents a failure in competent assessment and can lead to ineffective or even harmful interventions. A third incorrect approach would be to dismiss the client's reported experiences as simply stress or difficult life events, without considering the potential for underlying trauma. This minimizes the client's suffering and fails to recognize the distinct impact of traumatic experiences, which can manifest in ways that are not immediately apparent. This approach is ethically problematic as it can lead to a denial of necessary support and treatment, failing to uphold the duty of care. Professional reasoning. Professionals should employ a systematic, client-centered assessment process. This involves active listening to the client's narrative, exploring the temporal and relational aspects of their experiences, and observing their current functioning. Utilizing a trauma-informed lens, practitioners should consider the possibility of acute, chronic, and complex trauma, and gather sufficient information to differentiate between them. This information should then guide the development of a treatment plan that is specifically tailored to the identified trauma type and the client's unique needs and strengths, ensuring ethical and effective practice. Question 7. Process analysis reveals that a certified trauma and resilience practitioner, CTRP, is working with a client who has a severe anxiety disorder and is experiencing significant distress related to a recent public event. The practitioner realizes that this public event is deeply connected to a personal traumatic experience they have recently undergone, which has resurfaced with intensity. The practitioner is concerned that their own emotional reactions and potential for vicarious trauma might unconsciously influence their judgment and therapeutic approach with this client. What is the most ethically sound and professionally responsible course of action for the CTRP? Option A. Continue therapy as usual, believing that their professional training will allow them to manage their personal reactions and maintain objectivity, thus avoiding any negative impact on the client. Option B. Minimize the personal connection and focus solely on the client's presenting issues, hoping that their own emotional responses will subside without affecting the therapeutic process. Option C. Immediately terminate the therapeutic relationship without explanation to avoid any further complications, assuming the client will find another practitioner. Option D. Disclose the personal connection to the client. Explain the potential impact on their ability to provide objective care, and offer to refer the client to a trusted colleague who can provide specialized support. The correct answer is D. Disclose the personal connection to the client. Explain the potential impact on their ability to provide objective care, and offer to refer the client to a trusted colleague who can provide specialized support. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent vulnerability of a client experiencing a severe anxiety disorder, coupled with the practitioner's personal connection to a potentially triggering event. The practitioner must navigate the dual responsibilities of providing effective trauma-informed care while managing their own emotional responses and maintaining professional boundaries. The risk of vicarious trauma or countertransference impacting the therapeutic alliance is significant, requiring careful ethical consideration and adherence to professional standards. Correct approach analysis. The correct approach prioritizes client safety and therapeutic efficacy by acknowledging the practitioner's personal connection and its potential impact. It involves transparently communicating the perceived conflict of interest to the client and offering a referral to a colleague. This aligns with the ethical principles of beneficence, acting in the client's best interest, non-maleficence, avoiding harm, and professional integrity. Specifically, it upholds the duty to provide competent care, which includes recognizing when one's own issues might impede effective treatment and taking appropriate steps to mitigate that risk. This proactive approach ensures the client receives uninterrupted and unbiased support from a practitioner who can offer objective care. Incorrect approaches analysis. One incorrect approach involves proceeding with therapy without disclosing the personal connection. This fails to uphold the principle of informed consent, as the client is not aware of a factor that could potentially influence the therapeutic process. It also risks introducing countertransference, where the practitioner's unresolved personal issues unconsciously affect their perception and response to the client, potentially leading to harm or suboptimal treatment. This violates the ethical duty to avoid dual relationships and maintain professional objectivity. Another incorrect approach is to abruptly terminate the therapeutic relationship without offering a referral or adequate transition. While acknowledging the conflict is a step, abandoning the client without ensuring continuity of care is a failure of professional responsibility and beneficence. It can exacerbate the client's feelings of abandonment and insecurity, particularly given their anxiety disorder, and is contrary to the ethical obligation to support clients through transitions in care. A third incorrect approach is to minimize the personal connection and attempt to push through the therapy, believing it won't affect the client. This demonstrates a lack of self-awareness and an underestimation of the impact of personal experiences on therapeutic practice. It disregards the potential for subtle biases or emotional reactions to compromise the quality of care and can lead to unintentional harm to the client, violating the principle of non-maleficence. Professional reasoning. Professionals facing such dilemmas should engage in a process of ethical self-reflection. This involves identifying potential conflicts of interest, assessing the impact on the client and the therapeutic relationship, and consulting relevant professional codes of conduct and ethical guidelines. When personal issues may compromise objectivity or the client's well-being, the most ethical course of action is to prioritize the client's needs by seeking supervision, discussing the situation with the client transparently, and facilitating a referral to another qualified practitioner. This decision-making framework emphasizes client welfare, professional integrity, and adherence to ethical standards. Question 8. Compliance review shows a certified trauma and resilience practitioner, CTRP, is conducting a comprehensive trauma history with a client who begins to exhibit significant signs of distress, including tearfulness and verbalizing a desire to stop discussing certain topics. The practitioner needs to decide how to proceed with the history taking. Which of the following approaches best aligns with best practice evaluation for this situation? Option A. Shift the focus entirely to positive life experiences and resilience factors, completely abandoning the trauma history for the remainder of the session and future sessions until the client initiates it. Option B. Acknowledge the client's distress, validate their feelings, and offer the client the choice to pause the discussion, focus on immediate coping strategies, or revisit less sensitive areas of their history, assuring them that the pace will be guided by their comfort. Option C. Gently but firmly encourage the client to continue sharing the specific details of the traumatic events, explaining that a complete history is essential for effective treatment, and that pushing through discomfort is often necessary for progress. Option D. Immediately cease all trauma history taking and reschedule the session for an indefinite future date, without offering any immediate support or alternative discussion topics. Correct answer is B. Acknowledge the client's distress, validate their feelings, and offer the client the choice to pause the discussion, focus on immediate coping strategies, or revisit less sensitive areas of their history, assuring them that the pace will be guided by their comfort. Explanation. This scenario presents a professional challenge because a practitioner is attempting to gather comprehensive trauma history from a client who is exhibiting significant distress and resistance. The practitioner must balance the ethical and regulatory imperative to obtain a thorough history for effective treatment planning with the client's immediate emotional state and right to self-determination. Rushing the process or employing overly directive techniques could re-traumatize the client or violate their autonomy, while being too passive might lead to an incomplete history, hindering the therapeutic process. Careful judgment is required to navigate this delicate balance, ensuring the client feels safe, respected, and in control of their narrative. The correct approach represents best professional practice because it prioritizes client safety, autonomy, and the therapeutic alliance. By acknowledging the client's distress, offering choices, and proceeding at their pace, the practitioner builds trust and rapport. This aligns with ethical guidelines that emphasize informed consent, client-centered care, and the avoidance of harm. Specifically, regulatory frameworks for trauma practitioners often mandate that interventions be trauma-informed, meaning they recognize the prevalence of trauma and its impact, and actively avoid re-traumatization. This approach demonstrates adherence to these principles by creating a safe space for disclosure and empowering the client to participate actively in their own healing journey. An incorrect approach that involves pressuring the client to disclose specific details despite their evident distress is professionally unacceptable. This violates the ethical principle of do no harm by potentially re-traumatizing the client and can lead to a breakdown in the therapeutic relationship. It also disregards the client's autonomy and right to control their personal narrative, which is a cornerstone of ethical practice. Furthermore, such an approach may contravene regulatory requirements that mandate practitioners to operate within the client's capacity and comfort level, ensuring that the assessment process itself does not become a source of further harm. Another incorrect approach that involves abandoning the trauma history taking altogether due to the client's distress, without offering alternative strategies or rescheduling, is also professionally deficient. While client distress is a critical factor, a complete cessation of inquiry without exploring adaptive ways to proceed or support the client can be seen as a failure to adequately address the client's needs. Best practice involves adapting the approach, perhaps by focusing on immediate coping strategies or rescheduling for a time when the client feels more stable, rather than a complete withdrawal of the assessment process. This can be seen as a failure to uphold the practitioner's responsibility to facilitate the client's progress towards healing within ethical and safe boundaries. The professional decision-making process for similar situations should involve a continuous assessment of the client's presentation and emotional state. Practitioners should be prepared to adapt their strategies in real time, employing active listening, empathy, and validation. When faced with client distress, the immediate priority is to ensure safety and stability. This might involve employing grounding techniques, offering breaks, or shifting the focus to immediate coping skills. The practitioner should then collaboratively decide with the client on the next steps, whether that involves continuing the history taking at a slower pace, focusing on less sensitive areas, or rescheduling. This collaborative approach ensures that the client remains an active participant in their care, and that the practitioner is acting in accordance with ethical and regulatory mandates for client-centered, trauma-informed practice. Question 9. System analysis indicates that a practitioner is assessing an individual who reports experiencing a single, highly distressing event 3 weeks ago. The individual describes feeling on edge, having difficulty sleeping, and experiencing intrusive thoughts about the event. Which of the following approaches best aligns with the diagnostic criteria for trauma-related disorders and best professional practice in this scenario? Option A. Ask the individual if they have a history of other traumatic experiences, and if so, prioritize assessing for pre-existing conditions over the current event's impact. Option B. Conduct a thorough assessment of the client's experiences, systematically evaluating for the presence and duration of intrusive symptoms, avoidance behaviors, negative alterations in cognitions and mood, and alterations in arousal and reactivity, comparing these against the diagnostic criteria for acute stress disorder and post-traumatic stress disorder. Option C. Focus primarily on teaching the individual relaxation techniques and coping strategies, assuming that the symptoms will resolve on their own given the relatively short time frame since the event. Option D. Immediately diagnose the individual with acute stress disorder due to the recent occurrence of a distressing event and the presence of some stress-related symptoms. The correct answer is B. Conduct a thorough assessment of the client's experiences, systematically evaluating for the presence and duration of intrusive symptoms, avoidance behaviors, negative alterations in cognitions and mood, and alterations in arousal and reactivity, comparing these against the diagnostic criteria for acute stress disorder and post-traumatic stress disorder. Explanation. Scenario analysis. This scenario presents a common challenge in trauma-informed practice, differentiating between a transient stress reaction and a more persistent trauma-related disorder. The practitioner must navigate the nuanced presentation of symptoms, considering the timing, severity, and impact on the individual's functioning, all while adhering to diagnostic criteria and ethical guidelines. The professional challenge lies in avoiding premature diagnosis or underestimation of distress, ensuring the client receives appropriate support and intervention without pathologizing normal stress responses. Careful judgment is required to balance sensitivity to the client's experience with the need for accurate assessment. Correct approach analysis. The correct approach involves a comprehensive assessment that systematically evaluates the client's experiences against the established diagnostic criteria for trauma-related disorders, such as those outlined in the DSM-5, Diagnostic and Statistical Manual of Mental Disorders, 5th edition. This includes exploring the nature of the traumatic event, the presence of intrusive symptoms, memories, dreams, flashbacks, avoidance behaviors, negative alterations in cognitions and mood, and alterations in arousal and reactivity. The practitioner must also consider the duration of symptoms and their impact on daily functioning. This systematic, evidence-based approach ensures that the assessment is thorough, objective, and aligned with professional standards for diagnosing trauma-related conditions, thereby guiding appropriate treatment planning and intervention. Incorrect approaches analysis. One incorrect approach would be to solely rely on the client's self-report of feeling stressed or upset without a systematic exploration of specific diagnostic criteria. This fails to meet the professional obligation to conduct a thorough assessment and could lead to misdiagnosis or delayed appropriate care. Ethically, it represents a failure to provide competent assessment and potentially a breach of the duty of care. Another incorrect approach would be to immediately apply a diagnosis of PTSD based on the occurrence of a single traumatic event, without a detailed evaluation of the symptom clusters and their duration. This premature diagnostic conclusion bypasses the necessary diagnostic process, potentially leading to an inaccurate label and inappropriate treatment. It violates the principle of evidence-based practice and could cause undue distress or stigma for the client. A further incorrect approach would be to focus exclusively on the client's coping mechanisms without adequately assessing the presence and severity of core trauma symptomology. While coping is important, it does not replace the fundamental diagnostic assessment required to identify a trauma-related disorder. This approach risks overlooking a significant clinical issue and failing to provide necessary specialized interventions. Professional reasoning. Professionals should employ a structured, multifaceted approach to assessment. This begins with establishing rapport and creating a safe space for the client to share their experiences. Next, a detailed history of the traumatic event, should be gathered, followed by a systematic inquiry into each of the diagnostic symptom clusters for trauma-related disorders. This should be integrated with an assessment of the client's current functioning and their subjective distress. Decision-making should be guided by the DSM-5 criteria, clinical judgment, and ongoing consultation with supervisors or peers when necessary. The goal is to arrive at an accurate diagnosis that informs an effective, individualized treatment plan. Question 10. The assessment process reveals a client who reports experiencing significant trauma in their past and is currently struggling with polysubstance use, which they describe as a way to numb out the memories. The practitioner is considering how to best proceed with treatment planning. Which of the following approaches best reflects current best practice for addressing co-occurring trauma and substance use disorders? Option A. Develop an integrated treatment plan that concurrently addresses both the trauma symptoms and the substance use, recognizing the potential for each to influence the other. Option B. Prioritize addressing the substance use disorder with a focus on detoxification and abstinence, deferring trauma-focused therapy until the client is stable and substance-free. Option C. Focus exclusively on trauma-focused therapy, assuming that resolving the underlying trauma will naturally lead to the cessation of substance use. Option D. Recommend that the client seek separate treatment providers for their trauma and substance use disorders, with the expectation that they will coordinate care independently. Correct answer is B. Prioritize addressing the substance use disorder with a focus on detoxification and abstinence, deferring trauma-focused therapy until the client is stable and substance-free. Explanation. The assessment process reveals a client presenting with symptoms indicative of both post-traumatic stress disorder, PTSD, and a substance use disorder. This scenario is professionally challenging because the co-occurrence of trauma and substance use is complex, with each condition often exacerbating the other. Effective intervention requires a nuanced understanding of their interplay, potential for dual diagnosis, and the need for integrated treatment approaches. Careful judgment is required to avoid misdiagnosis, inappropriate treatment planning, and potential harm to the client. The correct approach represents best professional practice because it prioritizes a comprehensive, integrated assessment that acknowledges the bidirectional relationship between trauma and substance use. This aligns with current best practice guidelines and ethical standards for trauma-informed care, which emphasize understanding the client's entire experience. Specifically, regulatory frameworks and ethical codes for practitioners in this field mandate a holistic view of the client, recognizing that trauma can be a significant driver of substance use as a coping mechanism. And conversely, substance use can complicate trauma processing and recovery. An integrated approach ensures that both conditions are addressed concurrently, leading to more effective and sustainable outcomes. An incorrect approach that focuses solely on the substance use disorder without adequately assessing or addressing the underlying trauma fails to meet ethical obligations. This oversight can lead to treatment resistance, relapse, and a perpetuation of the client's distress, as the root cause of their coping mechanism remains unaddressed. Ethically, practitioners are bound to provide competent care, which includes recognizing and responding to the full spectrum of a client's needs. Similarly, an approach that solely targets trauma symptoms while minimizing or ignoring the substance use disorder is also professionally deficient. Substance use can interfere with trauma processing, create safety concerns, and hinder therapeutic progress. Ignoring this aspect of the client's presentation constitutes a failure to provide comprehensive care and can lead to negative consequences, potentially violating professional standards of practice. The professional decision-making process for similar situations should involve a systematic, client-centered approach. This begins with a thorough, trauma-informed assessment that explores both trauma history and current substance use patterns, including their onset, frequency, and impact. It requires the practitioner to maintain an open mind, avoiding premature conclusions. Next, the practitioner should consult relevant evidence-based practices, and if necessary, seek supervision or collaborate with other professionals specializing in co-occurring disorders. Treatment planning must be collaborative, involving the client in setting realistic goals that address both trauma and substance use, ideally through an integrated or parallel treatment model. Ongoing assessment and flexibility in adapting the treatment plan are crucial as the client progresses. Question 11. Strategic planning requires a thorough understanding of a client's presenting concerns. A new client reports experiencing persistent anxiety, intrusive thoughts, and difficulty sleeping, stating, "I just feel on edge all the time, and I can't shake this feeling that something bad is going to happen." The client also mentions a history of witnessing a significant accident several months ago. Which of the following assessment approaches best aligns with the principles of accurate trauma assessment and diagnosis for a certified trauma and resilience practitioner? Option A. Immediately diagnose the client with acute stress disorder based on the reported anxiety and intrusive thoughts following the witnessed accident. Option B. Assume the client's symptoms are solely a result of the witnessed accident and proceed with trauma-focused therapy without a formal diagnostic assessment. Option C. Focus solely on the client's current anxiety and sleep difficulties, recommending relaxation techniques without further exploration of the accident's impact. Option D. Conduct a comprehensive diagnostic interview utilizing the DSM-5TR criteria, exploring the nature and impact of the witnessed accident, assessing for a range of trauma-related symptoms, and considering differential diagnoses for anxiety and sleep disturbances. Correct answer is D. Conduct a comprehensive diagnostic interview utilizing the DSM-5TR criteria, exploring the nature and impact of the witnessed accident, assessing for a range of trauma-related symptoms, and considering differential diagnoses for anxiety and sleep disturbances. Explanation. This scenario presents a professional challenge due to the inherent complexity of assessing trauma and diagnosing related conditions, particularly when presented with a client exhibiting a broad range of symptoms that could stem from various sources, including but not limited to trauma. The CTRP practitioner must navigate the ethical imperative to provide accurate and effective care while adhering to professional standards and regulatory frameworks governing mental health practice. The need for careful judgment arises from the potential for misdiagnosis, which can lead to inappropriate treatment, client harm, and professional repercussions. The correct approach represents best professional practice because it prioritizes a comprehensive, multifaceted assessment that integrates client self-report with objective observations and, where appropriate and consented to, collateral information. This aligns with the ethical guidelines for practitioners, which mandate thorough assessment before diagnosis and treatment planning. Specifically, it reflects the principle of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm. Adhering to established diagnostic criteria, such as those outlined in the DSM-5TR, and understanding the nuances of trauma-related disorders is crucial. This approach also emphasizes the importance of cultural humility and considering the client's unique context, which is a cornerstone of ethical and effective practice. An incorrect approach that relies solely on initial client presentation, without further investigation, fails to meet the standard of care. This could lead to a premature or inaccurate diagnosis, potentially overlooking critical contributing factors or misattributing symptoms. Ethically, this violates the duty to conduct a thorough assessment and could result in harm to the client if treatment is based on a flawed understanding of their needs. Another incorrect approach that involves applying a single theoretical lens without considering alternative explanations or differential diagnoses is also professionally unacceptable. While theoretical frameworks are valuable, rigid adherence without flexibility can lead to confirmation bias and a failure to identify the full spectrum of a client's challenges. This can result in a treatment plan that is not holistic or effective, potentially causing client distress and hindering recovery. A further incorrect approach that bypasses the need for differential diagnosis and jumps directly to a specific trauma-related diagnosis based on a few shared symptoms is ethically problematic. Trauma can manifest in diverse ways, and many symptoms overlap with other mental health conditions. Failing to rule out other possibilities is a significant diagnostic error that can lead to ineffective or even detrimental interventions. The professional decision-making process for similar situations should involve a systematic approach. 1. Engage in active, empathetic listening to gather the client's narrative. 2. Conduct a comprehensive biopsychosocial assessment, exploring current symptoms, history of trauma, if disclosed and appropriate to explore, mental health history, substance use, social support, and functional impairment. 3. Utilize standardized assessment tools and clinical interviews to gather objective data. 4. Consider differential diagnoses, exploring other conditions that may present with similar symptoms. 5. Consult with supervisors or peers when facing complex cases or diagnostic uncertainty. 6. Develop a collaborative treatment plan based on a well-supported diagnosis, informed by the client's goals and preferences. 7. Continuously monitor client progress and reevaluate the diagnosis and treatment plan as needed. Question 12. The control framework reveals that a certified trauma and resilience practitioner, CTRP, is assessing a client who presents with significant difficulties in forming stable relationships and a pervasive sense of distrust, alongside intrusive memories and avoidance behaviors. Considering the core principles of psychological theories of trauma, which comparative analysis of theoretical approaches would best inform the CTRP understanding and intervention planning for this client. Option A. Comparing the emphasis of attachment theory on the impact of early relational disruptions on internal working models with the cognitive processing theories focus on the assimilation and accommodation of traumatic memories and their impact on core beliefs. Option B. Differentiating the principles of narrative therapy, which emphasizes the construction of self through stories, with the tenets of solution-focused brief therapy, which prioritizes future-oriented goals and strengths. Option C. Evaluating the neurobiological underpinnings of the fight-or-flight response, as described in stress response models, against the existentialist perspective on the search for meaning in the face of suffering. Option D. Contrasting the principles of psychodynamic theory regarding unconscious defense mechanisms with the tenets of behavioral theory that focus on observable stimulus-response patterns in the context of trauma. The correct answer is A. Comparing the emphasis of attachment theory on the impact of early relational disruptions on internal working models with the cognitive processing theories focus on the assimilation and accommodation of traumatic memories and their impact on core beliefs. Explanation. The control framework reveals that a certified trauma and resilience practitioner, CTRP, must navigate complex psychological theories to effectively support clients. This scenario is professionally challenging because it requires the practitioner to move beyond a superficial understanding of trauma theories and apply them in a nuanced way to a client's presentation. The practitioner must discern which theoretical lens best explains the client's current struggles and informs the most appropriate intervention, while remaining grounded in evidence-based practice and ethical guidelines. The correct approach represents best professional practice because it demonstrates a deep understanding of how different psychological theories of trauma conceptualize the impact of adverse experiences and their subsequent manifestations. By considering the core tenets of attachment theory, which emphasizes the role of early relational experiences in shaping an individual's capacity for emotional regulation and interpersonal connection, and contrasting it with the cognitive processing of trauma, which focuses on how individuals make sense of traumatic events and their implications for self and the world, the practitioner can tailor interventions. This comparative analysis allows for a more precise identification of the client's primary challenges and the development of a targeted, evidence-informed treatment plan that aligns with the CTRP scope of practice and ethical obligations to provide competent care. An incorrect approach that prioritizes a singular, unexamined theoretical framework fails to acknowledge the multifaceted nature of trauma. For instance, solely focusing on the biological impact of trauma without considering the psychological and social dimensions would be a regulatory and ethical failure. It neglects the interconnectedness of these factors and may lead to an incomplete or ineffective treatment plan. Similarly, applying a theory without considering the client's unique cultural context or lived experience would be a failure to provide culturally competent care, a core ethical principle for CTRP. Another incorrect approach might involve over-reliance on anecdotal evidence or unvalidated theories, which contravenes the CTRP responsibility to practice based on current scientific understanding and established best practices. This can lead to misdiagnosis, inappropriate interventions, and potential harm to the client. The professional decision-making process for similar situations involves a systematic evaluation of the client's presenting concerns through multiple theoretical lenses. This includes gathering comprehensive information about the client's history, current symptoms, and functional impairments. The practitioner then critically assesses how each relevant theory explains these elements, considering the strengths and limitations of each in the context of the individual client. This comparative analysis informs the selection of theoretical orientations and interventions that are most likely to be effective and ethically sound, always prioritizing the client's well-being and autonomy. Question 13. The risk matrix shows a high probability of symptom exacerbation when trauma survivors with co-occurring depression present with significant anhedonia and a history of dissociative episodes. Considering the CTRP ethical obligations and the need for effective intervention, which of the following approaches best addresses this complex presentation? Option A. Prioritize stabilization and the development of robust coping mechanisms for managing depressive symptoms and dissociation, followed by a phased, trauma-informed approach to processing traumatic memories and integrating them, while continuously monitoring for mood shifts. Option B. Immediately initiate intensive trauma processing techniques to address the root cause of the depression and dissociation, assuming that resolving the trauma will naturally alleviate the mood disorder symptoms. Option C. Focus solely on pharmacotherapy referral for the depressive symptoms, as mood disorders are primarily biological and require medical intervention, with trauma being a secondary concern. Option D. Implement a generalized resilience building program that focuses on positive affirmations and mindfulness without specific attention to the client's trauma history or dissociative experiences. The correct answer is A. Prioritize stabilization and the development of robust coping mechanisms for managing depressive symptoms and dissociation, followed by a phased, trauma-informed approach to processing traumatic memories and integrating them, while continuously monitoring for mood shifts. Explanation. This scenario presents a common implementation challenge for certified trauma and resilience practitioners, CTRP, when working with clients experiencing co-occurring trauma and mood disorders. The challenge lies in accurately assessing the interplay between trauma symptoms and mood disorder manifestations, and then developing an intervention plan that addresses both without exacerbating either. The risk matrix highlights the potential for misdiagnosis or inadequate treatment, leading to client harm. The correct approach emphasizes a comprehensive, integrated, and client-centered strategy. This involves a thorough assessment that differentiates between trauma-related symptoms e.g., flashbacks, hypervigilance, and mood disorder symptoms e.g., anhedonia, persistent sadness, while acknowledging their potential overlap and bidirectional influence. Best professional practice, as guided by CTRP ethical standards and relevant regulatory frameworks, assuming a U.S. jurisdiction for this example, adhering to principles of evidence-based practice and client welfare, dictates a phased approach. This typically begins with stabilization and safety, followed by trauma processing, and then addressing mood disorder symptoms, or an integrated approach where appropriate. The focus is on building resilience and coping mechanisms tailored to the individual's unique presentation, ensuring interventions are trauma-informed and do not re-traumatize the client. This aligns with the CTRP mandate to promote healing and well-being in individuals affected by trauma. Incorrect approaches fail to meet these professional and ethical obligations. One incorrect approach might be to solely focus on treating the mood disorder symptoms without adequately addressing the underlying trauma. This is a regulatory and ethical failure because it neglects a core component of the client's distress, potentially leading to superficial or temporary relief and a failure to achieve lasting resilience. It violates the principle of comprehensive care and can be seen as practicing outside the scope of trauma-informed practice. Another incorrect approach could be to immediately engage in intensive trauma processing without first establishing adequate safety and stabilization. This poses a significant ethical risk, as it can lead to re-traumatization, symptom exacerbation, and a breakdown of the therapeutic alliance, contravening the CTRP duty of care and the ethical imperative to do no harm. A third incorrect approach might be to apply a one-size-fits-all intervention, ignoring the specific nuances of the client's trauma history and mood disorder presentation. This is ethically problematic as it demonstrates a lack of individualized assessment and treatment planning, failing to meet the client's unique needs, and potentially hindering their progress towards resilience. Professional decision-making in such situations requires a systematic process. First, conduct a thorough and integrated assessment to understand the client's presenting problems, their trauma history, and their current mood state. Second, prioritize safety and stabilization, ensuring the client has adequate coping skills and support systems. Third, develop a collaborative treatment plan that is evidence-based, trauma-informed, and tailored to the individual's needs, addressing both trauma and mood disorder symptoms. Fourth, continuously monitor the client's progress and adjust the treatment plan as necessary, remaining attuned to any signs of distress or re-traumatization. Finally, consult with supervisors or peers when facing complex cases, ensuring adherence to ethical guidelines and best practices. Question 14. Assessment of how a certified trauma and resilience practitioner, CTRP, should best facilitate the development of resilience within a community that has experienced a recent natural disaster, considering the need to empower local leadership and leverage existing social networks. Option A. Organize a series of individual counseling sessions for affected residents to address immediate trauma symptoms and provide coping strategies. Option B. Implement a standardized, externally developed resilience program that has proven effective in other disaster-affected regions. Option C. Facilitate community-led workshops to identify existing strengths, coping mechanisms, and social support systems, and collaboratively develop a resilience action plan based on these findings. Option D. Focus on providing direct material aid and logistical support to the community, assuming that addressing basic needs will naturally foster resilience. Correct answer is C. Facilitate community-led workshops to identify existing strengths, coping mechanisms, and social support systems, and collaboratively develop a resilience action plan based on these findings. Explanation. This scenario presents a professional challenge because it requires balancing the immediate needs of individuals experiencing trauma with the long-term goal of fostering community resilience. The Certified Trauma and Resilience Practitioner, CTRP, must navigate complex interpersonal dynamics, cultural sensitivities, and the potential for secondary trauma within the community. Careful judgment is required to ensure interventions are both effective and ethically sound, adhering strictly to the regulatory framework governing CTRP. The correct approach represents best professional practice because it prioritizes a strengths-based, community-led model for building resilience. This aligns with the ethical guidelines of the CTRP certification, which emphasize empowering individuals and communities, respecting self-determination, and promoting sustainable well-being. By focusing on identifying existing community assets and facilitating collaborative problem-solving, the practitioner acts as a catalyst rather than a sole provider of solutions, fostering genuine ownership and long-term capacity. This approach is supported by the regulatory framework that mandates practitioners to operate within their scope of competence and to promote the autonomy of those they serve. An incorrect approach that focuses solely on providing direct, individual-level crisis intervention without engaging the broader community fails to address the systemic factors contributing to trauma and hindering resilience. This approach risks creating dependency and overlooks the inherent strengths within the community. Ethically, it may violate the principle of promoting self-sufficiency and could lead to burnout for both the practitioner and the individuals receiving support if not integrated into a larger resilience-building strategy. Regulatory failure could occur if this limited approach is deemed insufficient to meet the community's needs as outlined by professional standards. Another incorrect approach that imposes external solutions without understanding the community's context or involving its members is also professionally unacceptable. This top-down model disregards cultural nuances and local knowledge, potentially leading to interventions that are ineffective, culturally insensitive, or even harmful. It undermines the community's agency and can exacerbate feelings of disempowerment. This violates ethical principles of cultural humility and respect for diversity, and could be seen as a failure to adhere to the regulatory requirement of providing culturally competent care. A further incorrect approach that prioritizes rapid symptom reduction over long-term resilience building may offer temporary relief, but does not equip the community with the tools and capacities to withstand future adversities. This can lead to a cycle of recurring crises. Ethically, it falls short of the CTRP mandate to foster lasting well-being. Regulatory concerns may arise if this approach is found to be superficial and not aligned with the comprehensive standards for trauma and resilience practice. A professional decision-making process for similar situations should involve a thorough needs assessment that includes active listening and engagement with community members to understand their perceived strengths, challenges, and aspirations. The practitioner should then collaboratively develop a resilience-building plan that leverages existing community resources and fosters empowerment. This process requires ongoing reflection, adaptation, and a commitment to ethical practice, ensuring all interventions are grounded in the regulatory framework and best practices for trauma-informed care and community development. Question 15. Comparative studies suggest that chronic trauma can lead to significant alterations in brain structure and function, particularly impacting the amygdala, hippocampus, and prefrontal cortex. Considering these neurobiological shifts, which of the following approaches best reflects a CTRP role in supporting client resilience? Option A. Focusing exclusively on behavioral modification techniques to address observable symptoms, without delving into the underlying neurobiological mechanisms of trauma. Option B. Advising the client to consult with a neurologist for a comprehensive brain scan to identify specific areas of damage and recommend targeted pharmaceutical treatments. Option C. Suggesting that the client's experiences are primarily psychological and that focusing on cognitive reframing alone will resolve the neurobiological impacts. Option D. Implementing psychoeducation on the brain's stress response system and guiding the client in developing coping strategies that promote neuroplasticity and emotional regulation, drawing from evidence-based trauma interventions. Correct answer is D. Implementing psychoeducation on the brain's stress response system and guiding the client in developing coping strategies that promote neuroplasticity and emotional regulation, drawing from evidence-based trauma interventions. Explanation: this scenario is professionally challenging because it requires a certified trauma and resilience practitioner, CTRP, to apply nuanced understanding of neurobiological impacts of trauma in a way that directly informs client care, while adhering strictly to the ethical and regulatory guidelines governing their practice. The CTRP must differentiate between theoretical knowledge of neurobiology and its practical, ethical application, ensuring interventions are evidence-based and client-centered, without overstepping professional boundaries or making unsubstantiated claims. The correct approach represents best professional practice because it prioritizes a client-centered, evidence-based intervention that directly addresses the identified neurobiological impact of trauma. This aligns with the core principles of trauma-informed care, which emphasize understanding the biological underpinnings of trauma responses to guide effective support. Specifically, it reflects a commitment to utilizing current research on neuroplasticity and stress response systems to foster resilience, a key competency for CTRP. This approach is ethically sound as it is grounded in scientific understanding and aims to promote client well-being through targeted, informed strategies. An incorrect approach that focuses solely on generalized stress management techniques without acknowledging the specific neurobiological sequelae of trauma would be ethically problematic. It fails to adequately address the unique challenges presented by trauma-related neurobiological changes, potentially leading to less effective interventions and a missed opportunity to leverage trauma-specific recovery pathways. This could be seen as a failure to provide competent care, as it does not fully integrate the understanding of trauma's impact on the brain. Another incorrect approach that involves recommending specific pharmaceutical interventions or diagnostic assessments related to neurobiological changes would represent a significant regulatory and ethical failure. CTRP are typically not licensed medical professionals and are therefore prohibited from diagnosing medical conditions or prescribing medication. Engaging in such practices would constitute practicing outside the scope of their professional license and expertise, posing serious risks to client safety and violating professional conduct standards. A third incorrect approach that dismisses the neurobiological impact of trauma as purely psychological or behavioral would also be professionally unacceptable. This stance ignores the robust scientific evidence linking trauma to observable changes in brain structure and function. Such a dismissal could lead to a lack of empathy and understanding of the client's experience, potentially re-traumatizing them and hindering the therapeutic process. It fails to embrace a holistic understanding of trauma's effects. A professional decision-making process for similar situations should involve a thorough assessment of the client's presentation, a review of current evidence-based practices related to the neurobiological impacts of trauma, and a clear understanding of the CTRP scope of practice and ethical obligations. Professionals should continuously engage in continuing education to stay abreast of research in neurobiology and trauma. When faced with complex neurobiological considerations, consultation with other professionals, such as psychologists or medical doctors, should be considered when appropriate and with client consent, ensuring a collaborative and ethical approach to client care. Question 16. Quality control measures reveal that a CTRP is developing a resilience building program for a historically marginalized community experiencing significant intergenerational trauma. The practitioner has identified several potential intervention strategies from established trauma-informed care literature. Which of the following approaches best aligns with the ethical and regulatory framework for CTRP when working with this population? Option A. Focus primarily on psychoeducational modules detailing the neurobiology of trauma and coping mechanisms, delivered by the practitioner without extensive community input. Option B. Implement a widely recognized, evidence-based resilience program that has shown success in other populations, assuming its principles can be universally applied. Option C. Contract with external cultural consultants to develop a comprehensive program, with minimal direct involvement from the community in the initial design phase. Option D. Prioritize co-designing the program with community leaders and members, incorporating their lived experiences and existing strengths into culturally relevant resilience-building activities. The correct answer is D. Prioritize co-designing the program with community leaders and members, incorporating their lived experiences and existing strengths into culturally relevant resilience-building activities. Explanation: scenario analysis. This scenario is professionally challenging because it requires a certified trauma and resilience practitioner, CTRP, to navigate the complex interplay of systemic oppression, cultural nuances, and individual trauma experiences within a marginalized population. The practitioner must balance the need for culturally sensitive interventions with the ethical imperative to provide effective support, all while adhering to the specific regulatory framework governing CTRP. The risk of inadvertently perpetuating harm through culturally incompetent practices or failing to address the unique resilience factors present in this community necessitates careful judgment and a deep understanding of both trauma-informed care and the specific ethical guidelines. Correct approach analysis. The correct approach prioritizes a strengths-based, culturally humble framework that actively involves the community in developing and implementing resilience-building strategies. This aligns with best professional practice by recognizing that marginalized populations often possess inherent strengths and unique coping mechanisms developed in response to adversity. Engaging the community ensures interventions are relevant, respectful, and sustainable, directly addressing the ethical obligation to promote client self-determination and avoid imposing external, potentially inappropriate, solutions. This approach also implicitly adheres to regulatory guidelines that emphasize culturally competent practice and the prevention of harm, ensuring that services are delivered in a manner that respects the dignity and autonomy of individuals and communities. Incorrect approaches analysis. One incorrect approach involves implementing standardized, one-size-fits-all resilience programs without community consultation. This fails to acknowledge the diverse experiences and cultural contexts within marginalized groups, potentially leading to interventions that are irrelevant, ineffective, or even re-traumatizing. Ethically, this violates principles of client-centered care and self-determination. Regulatory failure lies in the lack of culturally competent practice, which is a cornerstone of ethical and effective trauma-informed care. Another incorrect approach is to focus solely on deficit-based models, emphasizing the trauma and vulnerabilities of the population without acknowledging or leveraging their existing resilience. This can perpetuate stigma and disempowerment. Professionally, it is an incomplete and potentially harmful intervention. Ethically, it neglects the inherent dignity and strengths of individuals and communities. Regulatory noncompliance occurs through a failure to provide holistic and empowering support, which is expected of certified practitioners. A third incorrect approach is to delegate the development of resilience strategies entirely to external experts without meaningful community partnership. While external expertise can be valuable, a lack of community involvement in the design and implementation phases can lead to a disconnect between the proposed solutions and the lived realities of the population. This undermines community ownership and sustainability. Ethically, it can be seen as paternalistic and disempowering. Regulatory concerns arise from a failure to ensure that interventions are genuinely responsive to the needs and capacities of the target population, potentially leading to ineffective or inappropriate service delivery. Professional reasoning. Professionals should employ a decision-making process that begins with a thorough cultural humility assessment, followed by collaborative needs identification with the community. This involves active listening, building trust, and understanding the specific historical, social, and environmental factors impacting resilience. Interventions should then be co-designed, piloted with community feedback, and iteratively refined. Ongoing evaluation should be community-led, ensuring that the process remains responsive and empowering. This iterative, collaborative, and culturally grounded approach ensures that interventions are not only effective, but also ethically sound and compliant with professional standards. Question 17. To address the challenge of selecting an appropriate evidence-based trauma intervention for a client presenting with complex trauma symptoms, which of the following approaches best reflects a risk assessment-informed, ethically sound, and professionally responsible practice for a certified trauma and resilience practitioner? Option A. Prioritizing the intervention that the client expresses the strongest personal preference for, assuming their desire indicates the most effective path forward. Option B. Relying on the practitioner's personal familiarity and comfort with a particular trauma intervention modality, assuming it will be effective for most clients. Option C. Conducting a thorough, individualized risk assessment that considers the client's specific presentation, history, readiness, and potential contraindications before selecting an intervention supported by empirical evidence. Option D. Implementing the most recently published evidence-based intervention, regardless of its specific applicability to the client's unique circumstances or potential risks. The correct answer is C. Conducting a thorough, individualized risk assessment that considers the client's specific presentation, history, readiness, and potential contraindications before selecting an intervention supported by empirical evidence. Explanation. The scenario presents a common challenge for certified trauma and resilience practitioners, CTRP, selecting the most appropriate evidence-based intervention for a client with complex trauma, while navigating the ethical imperative to prioritize client safety and well-being. The professional challenge lies in the nuanced nature of trauma, the variability of client responses, and the need to align intervention choice with established best practices and regulatory guidelines. Careful judgment is required to avoid imposing a one-size-fits-all approach and to ensure the intervention is both effective and ethically sound. The correct approach represents best professional practice because it prioritizes a thorough, individualized risk assessment informed by the client's specific presentation and history. This aligns with the core ethical principles of beneficence and non-maleficence, ensuring that interventions are tailored to minimize potential harm and maximize benefit. Regulatory frameworks for CTRP, while not explicitly detailed here due to the exam's specific jurisdiction focus, universally emphasize the importance of client-centered care, informed consent, and the use of interventions supported by empirical evidence. A comprehensive risk assessment is a foundational step in meeting these requirements, allowing the practitioner to anticipate potential challenges, contraindications, and the client's readiness for specific trauma-focused work. An incorrect approach that relies solely on the practitioner's personal preference or familiarity with a particular modality without a robust risk assessment represents a significant ethical and potentially regulatory failure. This can lead to the selection of an intervention that is not suitable for the client's current state, potentially re-traumatizing them or exacerbating their symptoms. Such an approach neglects the duty of care and the professional obligation to practice within the scope of one's expertise and evidence-based guidelines. Another incorrect approach that focuses exclusively on the most recently published research without considering the client's individual needs and readiness is also professionally unacceptable. Staying current with research is vital. Blindly applying the newest findings without assessing their applicability to a specific client's context can be detrimental. This overlooks the crucial element of clinical judgment and the ethical requirement to individualize care. A further incorrect approach that prioritizes client demand for a specific intervention over a professional assessment of its suitability, without adequate exploration of risks and benefits, also constitutes an ethical lapse. While client autonomy is important, it must be balanced with the practitioner's responsibility to guide the client towards interventions that are most likely to be effective and safe, especially in the context of trauma where vulnerability is high. The professional decision-making process for similar situations should involve a systematic approach. 1. Conduct a comprehensive assessment of the client's history, current symptoms, strengths, and support systems. 2. Engage in a collaborative discussion with the client about their goals and preferences. 3. Review the available evidence-based interventions relevant to the client's presentation. 4. Conduct a thorough risk assessment for each potential intervention, considering the client's readiness, potential for re-traumatization, and any contraindications. 5. Select the intervention that best balances efficacy, safety, and client preference, ensuring informed consent is obtained. 6. Continuously monitor the client's response to the intervention and be prepared to adjust or modify the treatment plan as needed. Question 18. The monitoring system demonstrates a consistent trend where clients report feeling dismissed during initial assessments, despite the organization's stated commitment to trauma-informed care principles. Which of the following actions best addresses this implementation challenge? Option A. Issue a general reminder to all staff about the importance of active listening and empathy, assuming individual practitioners will self-correct their approaches. Option B. Implement mandatory, one-time training sessions on trauma-informed care for all staff, with no subsequent follow-up or performance monitoring. Option C. Conduct a thorough review of intake protocols and client engagement strategies, incorporating direct client feedback into revised training modules and establishing regular supervision focused on the practical application of trauma-informed principles. Option D. Focus disciplinary actions on individual staff members identified in client feedback, without investigating broader systemic or training deficiencies. The correct answer is C. Conduct a thorough review of intake protocols and client engagement strategies, incorporating direct client feedback into revised training modules, and establishing regular supervision focused on the practical application of trauma-informed principles. Explanation. The monitoring system demonstrates a recurring pattern of clients reporting feeling unheard and invalidated during initial intake sessions, despite the organization's stated commitment to trauma-informed care principles. This scenario is professionally challenging because it highlights a critical gap between organizational policy and actual service delivery, directly impacting client well-being and trust. The core of the challenge lies in translating abstract principles into concrete, consistent practice across all staff members. Careful judgment is required to identify the root cause of this disconnect and implement effective corrective measures that uphold the dignity and safety of those seeking support. The correct approach represents best professional practice because it prioritizes a systemic, evidence-based response that directly addresses the observed deficit. By initiating a comprehensive review of intake protocols, incorporating direct client feedback into training, and ensuring ongoing supervision focused on the application of trauma-informed principles, the organization actively works to rectify the identified issues. This aligns with the ethical imperative to provide competent and compassionate care, ensuring that services are delivered in a way that minimizes re-traumatization and promotes healing. Regulatory frameworks for practitioners often emphasize the importance of continuous quality improvement and adherence to ethical standards that prioritize client welfare, which this approach embodies. An incorrect approach that focuses solely on individual staff reprimands without addressing systemic issues fails to recognize that the problem may be rooted in inadequate training, unclear protocols, or insufficient support structures. This approach risks alienating staff and failing to achieve lasting change, potentially leading to a violation of ethical duties to provide effective services. Another incorrect approach that dismisses client feedback as subjective or a minor inconvenience ignores the fundamental principle of client-centered care and the importance of lived experience in shaping service delivery. This can lead to a breakdown in trust and a failure to meet the ethical obligation to create a safe and validating environment. A third incorrect approach that relies on superficial training without follow-up or accountability mechanisms is unlikely to affect meaningful change. It represents a failure to implement trauma-informed care effectively, potentially violating professional standards that require demonstrable competence and ongoing development in sensitive areas of practice. Professionals should employ a decision-making framework that begins with objective data collection, as provided by the monitoring system. This data should then be analyzed to identify potential root causes, considering both individual and systemic factors. A collaborative approach involving staff, supervisors, and potentially clients is crucial for developing targeted interventions. Continuous evaluation of implemented strategies and a commitment to iterative improvement are essential to ensure that services consistently reflect trauma-informed principles and ethical obligations. Question 19. The control framework reveals that a certified trauma and resilience practitioner, CTRP, is working with a client who, during a routine assessment of life stressors, discloses a history of multiple adverse childhood experiences (ACE). The client is currently functioning well in their daily life and has not expressed immediate distress related to these experiences. The practitioner recognizes the potential long-term impact of these ACEs on the client's overall well-being and resilience. What is the most ethically and professionally appropriate next step for the CTRP? Option A. Immediately document the disclosed ACEs in the client's file and initiate a formal risk assessment for potential future harm, without further discussion with the client. Option B. Acknowledge the disclosure but decide not to delve deeper into the ACEs at this time, assuming that since the client is functioning well, the experiences are not currently relevant to their therapeutic needs. Option C. Advise the client that due to the identified ACEs, it is mandatory to report this information to a relevant Child Protective Services agency, regardless of current functioning. Option D. Gently inquire about the client's willingness to explore the impact of these ACEs on their current life and future goals, offering support and resources as needed, while respecting their pace and boundaries. The correct answer is D. Gently inquire about the client's willingness to explore the impact of these ACEs on their current life and future goals, offering support and resources as needed, while respecting their pace and boundaries. Explanation. This scenario presents a professional challenge due to the inherent tension between a practitioner's duty to protect client confidentiality and their ethical obligation to promote well-being, especially when significant trauma history, such as adverse childhood experiences (ACE), is identified. The practitioner must navigate the complex interplay of client autonomy, potential risk, and the limitations imposed by professional codes of conduct and relevant regulations. Careful judgment is required to balance these competing demands without causing undue harm or breaching professional boundaries. The correct approach represents best professional practice because it prioritizes a collaborative and client-centered intervention that respects the client agency while acknowledging the impact of ACEs. By seeking to understand the client's current functioning and their readiness for disclosure or support related to their ACEs, the practitioner upholds the principles of informed consent and self-determination. This approach aligns with ethical guidelines that encourage practitioners to empower clients and facilitate their healing journey at their own pace. It also implicitly acknowledges that direct disclosure of ACEs may not always be immediately beneficial or desired by the client, and that building trust and rapport is a prerequisite for deeper therapeutic work. An incorrect approach that involves immediately reporting the identified ACEs to a third party without the client's explicit consent or a clear, imminent risk of harm would represent a significant regulatory and ethical failure. This would violate the principle of confidentiality, a cornerstone of therapeutic relationships, and could erode trust, potentially leading the client to disengage from services. Such an action would likely contravene data protection laws and professional codes of conduct that mandate strict adherence to privacy unless specific legal exceptions are met. Another incorrect approach, such as dismissing the significance of the identified ACEs due to the client's current apparent stability, would be professionally negligent. This failure to acknowledge and explore the potential long-term impact of trauma, even if not immediately manifesting as acute distress, overlooks a critical aspect of comprehensive trauma-informed care. It risks missing opportunities to proactively address underlying vulnerabilities and build resilience, thereby failing to fully support the client's holistic well-being. This approach neglects the foundational understanding of how ACEs can shape development and future health outcomes. A further incorrect approach might involve pressuring the client to disclose details about their ACEs before they are ready, under the guise of therapeutic necessity. This coercive tactic disregards the client's emotional safety and autonomy. It can re-traumatize the client and damage the therapeutic alliance, hindering progress rather than facilitating it. Ethical practice dictates that the pace of exploration of traumatic experiences should be dictated by the client's readiness and capacity. A professional decision-making process for similar situations should involve a thorough assessment of the client's current presentation, their stated goals, and their expressed readiness for exploring sensitive topics. It requires a constant evaluation of the balance between confidentiality and the duty of care, always prioritizing the client's well-being and autonomy. When potential risks are identified, the practitioner should engage in a process of risk assessment. If necessary, consult with supervisors or peers, always seeking the least intrusive and most client-empowering course of action that aligns with ethical and regulatory standards. Question 20. Risk assessment procedures indicate a client presence with significant distress, including symptoms such as anxiety, intrusive thoughts, and difficulty regulating emotions, which are consistent with potential trauma-related mental health disorders. As a certified trauma and resilience practitioner, CTRP, what is the most appropriate best practice approach to address this situation? Option A. Conduct a comprehensive trauma-informed assessment to understand the client's experiences, identify their strengths, and collaboratively develop a personalized resilience building plan, while recognizing the need for referral if specialized mental health diagnosis or treatment is indicated. Option B. Provide a definitive diagnosis of a specific mental health disorder based on the presented symptoms and outline a treatment plan solely focused on symptom management. Option C. Immediately refer the client to a psychiatrist for a formal diagnosis and prescription of medication to manage their anxiety and intrusive thoughts. Option D. Focus solely on teaching relaxation techniques and mindfulness exercises to alleviate the immediate symptoms without exploring the underlying traumatic experiences. The correct answer is A. Conduct a comprehensive trauma-informed assessment to understand the client's experiences, identify their strengths, and collaboratively develop a personalized resilience building plan, while recognizing the need for referral if specialized mental health diagnosis or treatment is indicated. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the practitioner to navigate the complex interplay between a client's traumatic experiences and the manifestation of mental health disorders, while adhering strictly to the ethical and regulatory standards of the Certified Trauma and Resilience Practitioner (CTRP) framework. The practitioner must balance the immediate need for support with the long-term goal of fostering resilience, all within the defined scope of practice, and without overstepping into areas requiring specialized medical or psychiatric diagnosis. The potential for misinterpretation of symptoms or inadequate intervention necessitates careful, evidence-based, and ethically sound judgment. Correct approach analysis. The correct approach emphasizes a comprehensive, client-centered assessment that acknowledges the profound impact of trauma on mental health. It prioritizes understanding the client's unique experiences, their current presentation of distress, and their existing coping mechanisms. This approach aligns with best practices in trauma-informed care, which advocate for a holistic view of the individual, recognizing that trauma can significantly contribute to or exacerbate a range of mental health conditions. By focusing on the client's narrative, identifying strengths, and collaboratively developing a personalized resilience building plan, the practitioner upholds the ethical imperative to promote well-being and recovery within the scope of their certification. This approach is consistent with the CTRP commitment to evidence-based interventions and the ethical guidelines that govern practitioners in supporting individuals affected by trauma. Incorrect approaches analysis. One incorrect approach would be to immediately label the client's symptoms as a specific mental health disorder without a thorough trauma-informed assessment. This fails to acknowledge the foundational role of trauma in symptom presentation and risks misdiagnosis or inappropriate intervention. Ethically, this bypasses the requirement for a comprehensive understanding of the client's history and context, potentially leading to ineffective or even harmful support. It also oversteps the scope of practice for a CTRP, which is not to diagnose mental health disorders, but to support resilience in the context of trauma. Another incorrect approach would be to solely focus on symptom reduction without exploring the underlying traumatic experiences and their impact. This superficial approach neglects the root causes of distress and hinders the development of genuine resilience. It is ethically problematic as it fails to address the core issues contributing to the client's mental health challenges, thereby not fully supporting their recovery journey. A third incorrect approach might involve recommending specific psychiatric medications or interventions. This is a significant regulatory and ethical failure, as CTRP are not licensed medical professionals and are prohibited from prescribing or recommending medical treatments. Such an action would constitute practicing outside the defined scope of practice and could have serious legal and ethical repercussions. Professional reasoning. Professionals should adopt a systematic decision-making process that begins with a thorough understanding of the CTRP scope of practice and ethical code. When faced with a client presenting with symptoms that may indicate mental health disorders, the practitioner must first conduct a comprehensive trauma-informed assessment. This involves actively listening to the client's narrative, exploring their history of trauma, and identifying their current strengths and challenges. The next step is to collaboratively develop a resilience-building plan that is tailored to the individual's needs and experiences, focusing on empowering the client and fostering their capacity to cope and thrive. Throughout this process, practitioners must maintain clear boundaries regarding their role, referring clients to appropriate medical or mental health professionals when their needs extend beyond the CTRP expertise. Continuous professional development and supervision are crucial to ensure that practice remains aligned with best practices and regulatory requirements.